Here's another subject to that forensics, as part of forensics, forensic analysts have to deal with, and it's dead bodies. So again, this is a little bit, it might be a little bit gross to some of you, and might make you a little bit uncomfortable. So I'll try to keep a lot of the pictures. I'll try to avoid showing you a lot of the pictures. Well, when you talk about crime, one of the most violent ones is the crime of murder. And when you see dead bodies, it's very important for the forensic analyst to find out what happened, who did it, and what they have to work with is a dead body. So how do you get ideas from the dead body as to how the crime occurred and maybe who did it? So, here we go. The classic, line is "Dead men tell no tales." So kill the guy who knows your secret. That's the basic idea. However, from a forensic standpoint, dead men do tell tales, just not with their mouth. Their bodies, and sometimes even what remains of their body, even the bones and the teeth, can actually tell a story of what happened to them at their last moments. So the one thing that you really can't avoid if you want to do a good forensic analysis of the dead body is an autopsy. There are different kinds of autopsies. Now, there's a hospital autopsy that they do for diseases and medical, learning how to understand the medical conditions that were there. But we're dealing with the forensic autopsy. That's when you are trying to find, not diseases or anything like that, the cause of death, maybe the manner of death, and also to confirm pretty much what happened. It's also part of the reconstruction of the reconstruction of the crime. And this is, again, relative to criminal proceedings to find proof of what might have been done, and being able to exonerate or condemn a suspect based on what you see from the dead body. Here, in this case, we have professional doctors taking care of it. But in all cases, you have to have a careful record. It has to be kept. Many photographs. Got to make sure to photograph it because you're going to be coming back to the information that these doctors have claimed when you're unable to get to the body afterwards. The autopsy is the last time you can get information from this kind of the body, because very often the body's going to be buried afterwards and everything's going to be ruined. So they've got to take a careful record. In a way, it's also similar to the chain of custody we mentioned. Got to make sure you know exactly what's going on. General procedure, certainly not going to teach you how to do this, not in the video like this, but some things that you might not have realized are done are, besides taking parts of the body and we're removing it from the body and looking at it, you also take the clothing, examine the clothing, scrapings from the nail, even of a dead body. You never know, the person might have fought back and there may be the perpetrator's DNA might be in there. Buccal swabs, sometimes you want to know on a DNA match with the person who was killed. And recovered bullets also they've got to pay attention to. These bullets, they may have marks on them that can relate to a suspect's bullets. Also, the body parts have to be labeled and packaged. You're going to be examining, the forensic analyst is going to be examining, the limbs and the organs mainly. So label them, package them in case you need to see them later. And besides, the family's going to try to bury it, and so you're going to have to explain where the parts went. If you don't have a head, the family's going to say, "Hey, what did you do with it?" And you're going to cause a lot of problems. Label everything. Make sure you know where everything is. Even the parts that are not damaged. Parts that are damaged, of course, are most of greatest interest because that's where the crime specifically occurred. But even though they're not damaged, you also have to take a look at them and note and write down what happened. For example, if let's say the chest was not damaged, well, it's important. Maybe it was a short person that did something. Who knows? A lot of possibilities, but make a note of everything that you need to, or of everything that you can. Okay, there's the external examination before you do any of the cutting and removing of organs. Take a look at the height, the weight, the hair color, see if there are any identifying tattoos or scars. This may be helpful in identifying if nobody knows who the body is. Check to see if there's vomit or blood in the mouth. Again, that blood might be important. It might explain a little bit about how he was dead. Vomit might indicate, maybe he was tortured, maybe there was some bad reaction to drugs or something, or alcohol. Take a look at the wounds, stab wounds, gunshot wounds. A lot of times the person has a gunshot wound and the perpetrator, the suspect says, no, it was suicide. Happens often. So you take a look at the gunshot. If there's like gunpowder discharge right around the bullet hole, you can see it looks like stippling, like small black dots all around the bullet hole. Well, that means the muzzle is pretty close, and suicide is a viable possibility. If you don't see any of that, well, it might have been too far away for suicide. Again, we have to know these things. So that's part of the autopsy, the forensic autopsy. Well, of course, there's an X-ray examination. This will show, maybe there's a pattern of abuse. We see some scars that healed, some bones that broke and also healed themselves, not in a medical setting. Again, this might show a long time of torture or abuse. And it can also tell the path the bullet took. Did the bullet take an upward path? It's not likely to be a suicide. I'm saying upward path in the torso. I mean, if it goes up from below the chin, yeah, it certainly can be like that. But anyway, we have to know a bunch of things, and we also take X-rays. Okay, then you have to get to the inner organs. So what they do is they do a Y incision. It goes from the shoulders, like here the shoulders over here. So it goes like from the shoulders. You cut through all the ribs and the rib cage. You get all down to there. And again, the ribs on this side also, and all the way down to here. Then you peel away this entire thing, and you take it away. And you pull that all out. The bones are gone. You can get to the heart and everything else. So anyway, that's the Y incision. I mean, I'm not going to show you how to do it. But that's what it's called, and that's what they do in order to get to the stuff inside. Then, after you do that, and the bones are not in the way, you remove the organs, and you remove the brain too. There may be some information there. Some poisons get straight to the brain, like ethyl mercury or methyl mercury. So you want to examine the brain too. You do that with what they call a circular saw. I guess it's a saw that has a blade that goes in a circle like that. You carve a hole in his skull and pull out the brain from there. So everything is weighed and labeled and often examined with a microscope because there's important information there. And you can find drug use because we do look for drug use in these forensic autopsies. If there are any pre-existing conditions that the person might already have had some problem with his heart, you have to note it because maybe if you see a problem with his heart, it might have been due to a pre-existing condition. We take a look at the digestive tract too. Poisoning might be there. We don't usually check for poisoning unless there's a reason to check for it. But maybe the person ingested some drugs. Or very often that we want to know how long it's been since he died. If he had something like steak and like half of it's digested, well, I can tell you how many hours he was alive for. So that can tell a bit more about the time of death. We'll see a little bit other indications of the time of death, but finding how much his last meal was digested is, and assuming we know when he ate his last meal, but that's often known.